afternoon everyone, myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the techniques of proprioceptive neuromuscular facilitation. So there are strengthening techniques as well as stretching techniques. Strengthening techniques include rhythmic initiation, repeated contraction, slow reversal, hold and rhythmic stabilization. And contract, relax and hold, relax are included under stretching techniques. So first we are having the rhythmic initiation. So progression is from agonist pattern like passive, then active assisted and then active, which is used in limited range of motion due to increased tone and those who are unable to initiate the movement. Repeated contraction, patient move isotonically against maximum resistance repeatedly until fatigue is evidenced. So when fatigue is evident, then stretch at the point in the range should facilitate the weaker muscle and result in the coordinated movement. It is used to develop strength and endurance. Then slow reversal, it involves isotonic contraction of the agonist followed immediately by an isotonic contraction of the agonist. Used for development of active range of motion and normal reciprocal timing between the agonist and antagonist. Slow reversal hold, it involves isotonic contraction of the agonist followed immediately by an isometric contraction with the hold command given at the end of each active movement. It is used in developing strength at a specific point in the range of motion. Rhythmic stabilization, it uses an isometric contraction of the agonist followed by isometric contraction of the antagonist. It is used to increase strength and endurance. Next we are having the stretching techniques. So it is a combination of passive stretching and isometrics. It encourages flexibility and coordination, and it is used to supplement the stretching and is employed to make quick gain in range of motion, and also good range of motion makes better biomechanics, reduce fatigue and also prevent the overuse injuries. Contract, relax, it moves the body part passively into the agonist pattern. Patient is instructed to push by contracting the antagonist isotonically against resistance. So it is used when range of motion is limited by muscle tightness. Hold, relax, it begins with isometric contraction of the antagonist against resistance followed by concentric contraction of the agonist muscle. Next, PNF stretching. So the initial movement is in the direction of the stretch. Next, the athlete pushes in a direction against the stretch. The last movement is a repeat of the initial. So as shown in the figure also. So we are having the PNF pattern. Each pattern has three dimensions: flexion, extension, abduction, adduction, rotation. So movement occur in a straight line in diagonal direction with rotatory component. So for upper extremity, these are the patterns. Patterns for shoulder: D1 flexion, which includes shoulder flexion, adduction, external rotation, forearm supinated, wrist radial flexion and finger flexion. Next, D2 flexion, which D2 flexion include shoulder flexion, abduction, external rotation, forearm supination, wrist radial deviation, fingers extension. Then next, D1 extension, shoulder extension, abduction, internal rotation, forearm pronation and wrist ulnar deviation and extension, finger extension. Next we are having the D2 extension. In D2 extension we are having the shoulder extension, adduction, internal rotation, forearm pronation, wrist ulnar deviation and extension and finger flexion. So this is in the figure 1, there is a diagonal 1 and the diagonal 2. So in these 4 figures we can see this is how the pattern of PNF is performed with the shoulder joint. So in this way. Then we are having the lower extremity. In lower extremity, usually there is flexion, adduction, external rotation, dorsiflexion, supination, inversion and toe extension. And in flexion, abduction, internal rotation, dorsiflexion, pronation, eversion and toe extension. So then the extension, adduction, external rotation, and extension, abduction, internal rotation. So diagonally the one performed. So this is how in the first figure D1 lower extremity movement pattern moving into flexion, starting position, and then in the figure second terminal position. Then in the third figure we are having the limb is moving into extension, starting position, and then we are having the terminal position. So again D2 lower extremity movement starting terminal position are shown in these four figures. So in lower trunk, when we are moving into flexion, so the body part, like for example right hip and the left hip, ankle, toes, hand position, these are shown here when the patient is moving into flexion, and the verbal command would be pull up and in. And when while moving into extension, the starting position and terminal position for right, left hip, ankle, toes, and hand position of trainer are shown with the verbal command push down and out. So this is the figure showing the patterns performed by the trainer on the patient. So for upper extremity, while moving into flexion, the right upper extremity and left upper extremity, hand grasp, trunk, head, and the position of athletic trainer while moving into flexion is shown with the verbal command pull down, and while moving into extension, the body part right upper extremity left, and trunk, head, hand position as shown with the verbal command push up. So these are the patterns which are performed by the trainer or physiotherapist on the patient. So PNF in sports, like there are some guidelines when completing the PNF stretching. Leave 48 hours between PNF stretching routines. Perform only one exercise per muscle group in a session. For each muscle group, complete 2 to 5 sets of the chosen exercise. And each set should consist of one stretch held for 30 seconds after the contracting phase. Then PNF stretching is not recommended for anyone under the age of 18. And if PNF stretching is to be performed as a separate exercise session, a thorough warm-up consisting of 5 to 10 minutes of light aerobic exercise and dynamic stretches. And also the Journal of Athletic Training, PNF techniques are most frequently applied during rehabilitation of knee, shoulder, hip, ankle. The most frequently used techniques were contract, relax, and hold, relax, and the use of PNF techniques in the muscle re-education phase of rehabilitation. Thank you.